Hello, this is Kelsey Larson. I am doing a case study, part two. The school is Ball State University, and the course is SPCE 638803. A refresher on my client's description: he is a male, age 6, with autism spectrum disorder as the diagnosis, as well as ADHD. Some behaviors of concern included vocal protests, physical refusals, aggression, and SIBs. For this intervention, I will be targeting the behaviors of vocal refusal and physical refusal, as well as combining both of those into this intervention. So, vocal protest was defined as any instance which the client exceeds voice volume of normal talking voice indoors when not engaged in play with yelling needed or in response to a demand. A refresher on physical refusals: the client had, which is any occurrence of the following: laying on the ground, pretending to sleep, throwing toys. For this assessment, we did a functional assessment, and the results gave us that the function is maintained by access to tangible and escape. So for our intervention goals, we would like to focus on socially acceptable replacement behaviors for yelling, no, and laying on the floor when asked to transition to task demands, as well as when tangible items are removed or not available to the client. We previously have used an intervention which consisted of requesting more time with preferred activities when asked to transition, and this intervention significantly decreased the vocal and physical refusals during transitions. The current intervention will use a DRA with emotional regulation tools such as coping sequences, and this is a culturally responsive intervention because we are taking into account the parent's priorities for the client, and emotional regulation was one of these high priorities for the parents. So we wanted to increase awareness of emotions as well as identify specific breaks that we can use with the client. For our antecedent intervention, we used a single stimulus preference assessment with the client to identify the highest preferred coping tools that are available for an alternative behavior to vocal and physical refusals. The items and corresponding cards were placed in a gallon bag for easy transportation around the clinic. So this preference assessment included the concept of assent with the intervention, with asking the client for each tool, do you like this or do you not like this? And offering one at a time. And we made sure to only include and rank the options that the client played with and stated, I like this for. So some of the top ranked coping tools included this ball maze fidget cube, Pop It dinosaur, Play-Doh, putty, and some Batman breaths. We would like to also teach feelings proactively and reactively as part of the intervention. So we included a visual chart with I feel, and we have a Velcro space in the middle for the picture to be moved to of the emotion that the client chose. So we have just a couple emotions to start with. I think we included happy, sad, tired, hurt, and I think hungry. The sequence is completed one time per hour during ABA as a proactive intervention strategy for the client's noncompliance. So we would present this I feel chart at least once an hour. It could be during play, so we're having him say I feel happy, or it could be during maybe he gets hurt in the gym. We'll quick present that. That would be a reactive implementation of this. So our behavior intervention goals specifically highlight functional communication training, DRA, and escape man training as a DRA. When denied access or relinquishing a reinforcer, we're teaching the man I feel. So how are you feeling? We want the client to say, I feel angry. And then we're going to be really quickly getting those coping tools out. And we're going to say, what kind of break does your body need? Or it looks like your body needs a break. So let's choose from our coping skills. And we'll let him make his own sequence. So this is going to be 2 to 3 items out of the bag. And we use these Lego Duplo blocks for him to stack each coping tool on top of each other to make a sequence. And after he finished one tool, we will set that aside and continue until the last block is used. And then after that, we're going to deliver some positive feedback. We're going to say, great job using your coping tools. How does your body feel now? We want him to identify that he is calm, he is happy. And if not, then we are going to repeat that. We are going to ask him to complete another at least 2 coping skills until his body is calm. For escape man training, this is going to be mostly at the table or during non-preferred transitions, usually away from our gym playground area. So we're going to use the same phrase, looks like your body needs a break, and then quickly provide those coping skills. And we will shape the request for a break with honoring fully prompted vocal commands and then fading to accept independent manding of him saying, I need a break. We're going to deliver positive feedback and reward with 3 to 5 minutes of a break, and this will be with those coping tools. So looking a little bit further into our interventions, this is similar to the last slide, but prompting verbally, how are you feeling? Especially when precursor behavior such as whining is observed. And we're going to present that emotion visual very quickly. And we're going to use most to least prompting to aid in the client choosing a picture and placing it on the visual. Then for the escape training, we're going to prompt, let's use our coping tools and give large amounts of verbal praise when he makes that sequence of coping tools. And we will be shaping this, as was discussed earlier, to reinforce those independent mans for a break. Some motivating operations here. So for our manding with I feel, deprivation plays a role as the establishing operation because the client is only allowed the preferred coping tools if he mans with a feeling first. It has an evocative effect because it led to an increase in the client identifying his feelings and communicating to get what he desires rather than engaging in vocal and physical refusals. For the escape portion, we have an establishing operation, which is also deprivation from highly reinforcing tangibles like Legos and gym. He must complete the staff social demands during DTT to earn these. So requesting the break allows him to access increased reinforcement for completing the non-preferred transitions in the absence of vocal physical refusals. And it also has shown an evocative effect, which increased the frequency of asking for a break and using the coping skills. To measure, we first started with an FR1 for manding with feelings being prompted every time from staff. During the intervention, we had to continue FR1, although there were a couple spontaneous during heightened levels of emotions. And at the end of the intervention, it'll be a VR2, so an average of every 2 responses we will reinforce. For manding for a break, we're starting at FR1, verbally prompting every time. Same for during intervention. We want to make these breaks accessed by the client at a high enough rate and giving enough reinforcement for using them. And then at the end, we can use a VR2 for the coping tools. For maintaining the skill, so once the client mans with verbal prompting for I feel sad, then we can reinforce this, and it will be contingent upon appropriate spontaneous manding. So, can I have a break after stating that he feels a certain way? And this will be in the absence only of vocal and physical refusal. And we can thin this schedule of reinforcement from a FR1 to a VR2. And then to ensure generalization through this intervention, we discussed with parents, and during parent trainings, we will develop some consistency in the home and other settings, such as school, where behaviors do occur during non-preferred transitions, denied access conditions. And this will ensure the client works with a variety of different people as well as technicians during ABA. We want to generalize this skill to lots of people in home and out of home. And we also will want to ensure access to preferred coping and break strategies in all environments. So getting similar tools that help during ABA, we should have those available at school as well.